This video is a quick example of what is done to remove a mole in a minor surgical procedure. That includes going over the procedure with the patient, performance of the surgery itself, and discussing post-surgical care with the patient. This video is no way 100% accurate as to what is done for a mole removal, because we are not licensed providers. We are just a group of medical assistant students that have made an example of a minor surgical procedure of a mole removal. And now we would like you to stay silent until the end. Without further ado, enjoy.
Hi, good morning. How can I help you?
I'm here for my appointment.
Okay. What's your date of birth?
11/26/1995.
Okay. Randolph?
Yes.
Okay, perfect. So I'm gonna go ahead and check you in, and they'll call you up in just a few minutes. Okay? You can take a seat over there.
Over here?
Yeah.
Okay. Thank you.
Hi.
Hi.
Are you Randolph?
Yes.
Can you follow me?
Okay.
Can you verify your name and date of birth?
Randolph, and my date of birth is 11/26/1995.
Your last name?
Bumala.
Oh, okay. What makes you new?
I just wanted to get my mole removed.
Oh.
Yeah.
Is it pain?
Not too much pain, but it's just been bothering me.
Oh, okay. Okay, let me take your vitals.
Okay.
Before doing the minor surgery or procedure, we take the patient's vitals to make sure their body will be able to handle the surgery. So everything was just fine after it. Even though this is a small procedure, we still want to do it when the patient is in homeostasis to avoid any other possible complications that may come up after the surgery.
The doctor will be here shortly.
Okay. Thank you.
Hello.
Hello.
Dr. Morales here.
Nice to meet you,
So,
Randolph.
nice to meet you. So I see the MA informed me what you're here for.
Yeah.
So tell me a little bit about how
My mole?
that grew and were you
Yeah.
born with it or?
Yeah, I started noticing it when I was like 5 years old,
Mhm.
and then started giving me insecurity issues.
Did it ever like grow inside?
Yeah, it started growing. It's still kind of growing.
Oh.
Yeah, it actually grew yesterday.
Do you feel any pain or
Sometimes I feel pain.
like
But
when you touch it or any of
Yeah.
that? Oh, you do feel pain?
yeah, I'll put a shirt on or something.
Okay. Alright, so I have my MA here. She is going to be a witness that you are going to sign the papers. Basically, the summary factors are that,
Can I take a look at it?
yeah, go ahead.
Before the minor procedure, Dr. Morales must give her informed consent to the patient about the procedure and the post-surgical care for the place of which the mole has been removed from. Some of the risks that the patient has during a mole removal surgery is the area has a chance to be infected, or the patient might have an allergic reaction to the anesthetics, or damage to nerves may happen, but that is very rare to occur. Usually what happens most of the time when a mole is removed is a scar forms on the area of the removal. During the time that the doctor is giving the informed consent, a witness must be present. In our case it's usually the medical assistant. The witness, or the medical assistant must witness that the patient has heard the informed consent and signed the consent form, agreeing to go through with the procedure and the possible outcomes that may come with it. The main surgical tools that will be used for this mole removal are tissue forceps, scalpel, catheter forceps, and a medicine cup, followed by a custom fenestrated drape, sterile gauze, and a solution to clean the area of the removal of the mole. After the area from which the mole will be removed from is cleansed with something like alcohol, that area is later numbed so the patient had minimum discomfort. During the removal surgery, the area is numbed with an anesthetic called lidocaine. During the mole removal, the surgeon or the doctor uses tissue forceps to pull on the mole, thus creating tension of the skin, which makes it easier for the scalpel to simply cut off the mole. We use the fenestrator drape to reduce the mess created by the blood or other tissue fluid that may come out when removing the mole. To clean the area even more, an assistant uses the catheter forceps to hold the gauze and clean off the area. Sometimes, an electric tool will be used to remove loose tissue from the mole. Depending on the size of the mole, sutures may be used, but in our case the mole was not too big, so a simple bandage did the trick. Sometimes, moles aren't just removed because of discomfort for an individual. Sometimes a mole could be cancerous, so to test if a mole is cancerous it must be removed and sent to the lab to find it out. Now I would like to show you some other quick ways on how a mole is surgically removed. And now, let's get back to the patient.
Alrighty, so now the procedure is over. I just want to go over some post-surgery care. So we want to make sure that the area stays clean and we prevent infection.
In our clinic, we discuss the post-surgical care of the wound during the informed consent and after the procedure. For the post-surgical care of the wound, the patient is told to clean it twice a day until it heals, and if the wound is not being healed properly, or the patient suspects infection, they then must come to the clinic as soon as possible to get it checked.
What's wrong?
Hi, nice to meet you.
Hi.
I'm Dr. Morales.
Nice to meet you, Randolph.
Oh, nice to meet you. Oh, retry. You won't feel anything in the site. You'll
Okay.
weight right and everything, and we'll just snip it right off.
Okay.
So let me get my AF. Hold on, I forgot what I was gonna say.
Like down.
Okay. Okay, so I'm gonna go grab the consent form for you, and then I will talk a little more about.
Okay, yes.
I'll
Sure.
talk a little bit more.
Sure.